video is for basic facial, and we'll start this video as if I have just arrived at work. So the first thing that I'm going to do is I'm going to wash my hands. So I'm going to wet my hands at the sink, and I'm going to get a coin-sized amount of liquid hand soap, and I'm going to wash my hands down to the wrist, and then I'm going to wash the back of my hands down to the wrist. I'm going to wash my fingers. I'm going to wash the backs of my fingers. I'm going to wash my fingertips and my nails. I'm going to wash between my fingers. I'm going to wash between my fingers and my thumbs. I'm going to wash my thumbs. I'm going to wash my wrists, and I'm going to do all of that interlocking wash for a minimum of 20 to 30 seconds. And when I feel like I've had a good and proper wash, I will rinse them thoroughly underneath the water. Then I'm going to grab either disposable paper towels or a clean towel, turn the faucet off, completely dry my hands off. If it is the paper towels, they're going to go in the trash. If it's a clean towel, it's dirty, and it will go in a closed container until time for laundry. Once I finish that, I'm going to find my 70% ethyl alcohol hand sanitizer, and I'm going to sanitize my hands thoroughly. And once I've done my hand sanitizer, it would be time for me to prepare my room for my client who's coming in for a basic facial. So let's review what we're going to do for that. So you're going to disinfect your workstation, bed, and equipment before your client even arrives. So remember, we're making sure that we do everything we possibly can before the client comes in for a service to not only be mindful of their time, but also your time. You want to make sure that you're giving them their full service time and that you're on task for your day as well as the client's time and schedule. So anything you can do before they get there, you want to do. We will use a disinfectant wipe, follow manufacturer's instructions to disinfect that workstation, bed, and equipment. We'll check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. We'll gather clean supplies needed for the facial service, storing in a clean closed container. We'll turn on the hot cabbie and stock with at least 3 clean wet towels. More may be needed depending on the service and the client's needs. We will fill clean steamer glass with distilled water and preheat the steamer. We'll dispense products needed for the service according to skin type and client's needs as follows. We will prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or remove product with a disinfected or clean single-use spatula. Close the lid to the product and set the portion cup tray on the tray. We'll drape the facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place clean laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. Lay a hairnet and headband on top of the first towel, along with a roll towel to support the head and neck of the client. Save the third towel to lay across the client's décolleté. So I'm going to show you what I've prepared on my tray. If you can see it, you may not be able to, but I'll review it. And then we have our client consultation to do, but just in case you can see, oh, you can see a little bit. So I have 4 squares, I have cotton rounds, I have 2 squares, I have astringent, water makeup remover, I've got disposable gloves, I've got a brush for my mask application. Of course, I've got those disposable sticks they were talking about to scoop product out and throw away. I also have wooden stick Q-tips for the extraction section. And then product-wise, I have cleanser, exfoliant, massage mask, eye cream and moisturizer, and I also have toner. So at this point, what needs to happen is I need to do my client consult. So just always note that when you do this, you will be approaching your client with clean hands. I'm going to be cleaning my hands again before the service, but I always just like to make that notation that I would never approach the client with dirty hands. So my hands are clean. I'm going to go do my client consultation. I'll get her situated and I'll wash my hands again before service. Obviously, some of these things that are on my tray may not be able to be set up until you do your client consultation if you need to learn about their skin type, etc. But you have a starting point at least, and you can have almost everything out. So once again, that you're mindful of time. So let's review client consultation. So you'll greet the client and escort them to the work area. You're going to determine the client's preferences and assess the client's needs. You'll assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, to prevent from safely performing the service. You'll assess the client's consultation form for any medications and products used within the last 72 hours, consult on any known allergies. You'll consult with the client on any facial surgeries within the last 3 months and if the client's under a physician's care. You'll assess if the client is prone to cold sores or fever blisters. Assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. You'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from any of those contraindications, you can move forward with the service. And our client is, but you really do want to take a lot of time during that client consultation to make sure you know all of the specifics about your client. You don't want to do anything that would harm them, their skin, or cause any kind of reaction. So it is really important to deep dive into that and note that all of those things can affect the skin, the strength of the skin, whether or not it can handle different things. So it's so important that you ask those questions, and if it's a new client, that you really get to know your client before you move forward with the service. And obviously you're only doing that analysis with your eyes. You're not getting in there yet to really see what's happening, but make sure you go over all those things on the form. Super important. And then you'll take your client to the facial room and give them some privacy, because they'll have to change into a drape so that this part is out, and then they're going to get into onto the facial bed and get comfortable. So my client has done that. She is, I've given her that quiet time, and now I'm going to take it to the next step. So I've got my roll towel here that I'm going to put underneath her neck, and I've got a hairnet that I'm going to use to keep her hair off of her face while we perform the service. And then I have that extra towel that I am going to put on her across her décolleté. We are going to be working there, but just gives that little extra added bit. And then before I start performing the facial, I will need to wash my hands again. So I would go to the sink and wet my hands, and I would get that coin-sized amount of liquid hand soap. I'd wash my hands together down to the wrist, wash the back of my hands down to the wrist. I'd wash my fingers, and I'd wash the back of my fingers. I'd wash my fingertips and my nails. I'm going to wash between my fingers. I'm going to wash between my fingers and my thumbs. I'm going to wash my thumbs, of course. I'm going to wash my wrists, and I'm going to do all of that interlocking wash for a minimum of 20 to 30 seconds. And then I'm going to thoroughly rinse everything underneath the sink. When I feel like I've gotten a proper rinse, I'm going to find some disposable paper towels or a clean towel, grab that, and then turn the faucet off with the towels, dry my hands off. If it's paper towels, it's going to go in the trash. That clean towel is now dirty, and it'll go in a closed container for laundry later. And then I'm going to get my hand sanitizer, 70% ethyl alcohol, and I'm going to sanitize my hands. So my hands are nice and sanitized. I will be ready to start the facial. And so the first thing that I'm going to do for my client is take off her makeup. Some clients may wear more, some clients may wear less. So just take your time. This is her time to relax and feel good, so you definitely want to make sure you provide that in your service. just going to dry her off. And it's time to do our first cleanse. And after you do that first cleanse, you're going to remove it. And then once you get that cleanse removed, you're going to cover up your client's eyes. So I'm just going to get some cotton rounds here. And you're going to bring over your magnifying lamp. And you will turn it on. And what you're going to be able to do is analyze your client's skin. And you're going to really want to take your time here, because this is where you're going to be able to see everything that you need to see that your client may be dealing with on their skin. And also maybe this is an opportunity for you to be looking for things that you discussed in your client consultation. So I'm just going to move that out of the way so we can talk about that. So basically what we're doing here is we're taking the time to look for things like hyperpigmentation, fine lines and wrinkles, maybe dehydrated skin, excess sebum, any broken skin, anything that your client has said is maybe a potential concern, but also things that it's your job to be looking for, not only for you to maximize this service with your client, but also to be able to help that client find the right products for home use to maximize their skin health. And also you are going to want to be looking for a way to help strengthen and benefit their skin going forward, maybe figuring out services to recommend, whatever their skin goals are that you guys are trying to achieve together. And the other thing is that this is your client and you're their skin expert. So you want to make sure that you are notating all the details of great skin for your client, so that when your client continues to come back, you're the person that knows everything about the skin. So you either notate it in the client consult form if you are using that, or maybe your software system, so that if anything changes throughout the course of an appointment to an appointment where you're looking at the skin, you'll notice it, and maybe before even she does, because you're using the magnifying lamp, or he does, and you'll be able to maybe potentially get them to the next step, whether that be a change in a mole or a freckle that's a concern for you, and you're going to coach them and get them to the proper physician, just get everything evaluated, whatever it is that you feel like is the right thing to do. So just keeping that in mind, you do want to spend a little bit of time here. It's important. When you're finished, you turn that light off like I did, take it out of the way, and then you can take the cotton rounds off your client, and then it's time for you to do that second cleanse. And then you'll remove that second cleanse. And then third and final cleanse. where you want to make sure if there's any debris or makeup or anything left, this is where you get it off. And then you're really going to want to take time, get this cleanser off, so you can move forward. Once you remove that third cleanse, you're going to need to tone. Once you've applied your toner, you're going to move forward to the exfoliation step. So I'm going to get a little bit of exfoliant and I'm going to apply it with my fingers. And I'm going to spread it around a little bit because I'm going to take the time to massage it in. Of course, we're going to avoid the eyes, the nose, the mouth. So we're going to do a little massage, and you can do that anywhere from 1 to 2 minutes based on your type of exfoliant, manufacturer's directions, etc. You're always going to pay attention to all of that. course, we're going to avoid the eyes, the nose, and the mouth like we do with everything. Once you've massaged that exfoliant in really good, we're going to discuss what happens next in the process of exfoliation. Because I don't have that equipment, we're going to talk about it. So at this point, you would retrieve the steamer and turn the steamer on. Position the steamer next to the facial bed and make sure that it is facing away from the client as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, you can position the steamer 16 inches over the client's face and aim it at the client's chin for even distribution on the face, allowing the unit to function for 3 to 5 minutes. Then you would remove the steamer from the client's face, return the steamer to its previous location for disinfection. So, because we don't have the equipment and we're doing a video, just going to walk through it. So I'd be bringing that steamer over to the client here, and I would make sure it's facing away, turn that steamer on, and let the outflow of a mist, even mist, happen. Once that happens, then I can turn the steamer toward the client's chin about 16 inches away, and then the steam is just going to flow nicely up and over the face. And then you would hold there for 3 to 5 minutes. Once that time has elapsed, which for the video, obviously, we're going to pretend like it has, you would turn the steamer away from the client's face, go ahead and take it out of the way, turn it off, and leave it out of the way of you and your client until the end, and then you're going to be able to disinfect, etc. So we're going to pretend like we've done all of that and that we're now going to remove the exfoliant. So we would be getting a hot towel from the cabbie. I also do not have a cabbie, so I'm just going to pretend and get a towel right here. So I've got my hot towel from my cabbie. I'm shaking it out. And one thing I would do is immediately, once I shake it, test it on my wrist until the temperature is comfortable. Once it's comfortable for me, I'm also going to test that temperature on my client's collarbone. And when she says okay, I'm going to make my pretty little fold, and then I'm going to place the steam towel on my client's face. And I'm going to cover everything up but the nose. So I'm going to wrap it around nicely. And just one thing to note, if you don't have a steamer like I don't, you could, if you had a hot cabbie, you could do that same kind of system with hot towels. You would just replace them every 30, 40 seconds as they cool off. You would replace them with a new hot towel for that 3 to 5 minutes. And then as that towel starts to cool down, you can remove the exfoliant. you really want to dry your hands off because it's time for extractions if the client needs it, and you need to put on disposable gloves. So you need dry hands to do that because it's difficult to do with wet hands, no question. And then you will remove any or do any extractions you need to. So there's a couple ways to do extractions. You could use cotton round soaked in astringent and kind of work your way around the cotton round and then toss it. I'm going to use wooden stick Q-tips soaked in astringent, but for every single extraction, you would use a set of Q-tips and then toss it. The other thing to keep in mind is that you may want to use your magnifying lamp, and if that's the case, if you're going to use it, to perform your extractions, before you turn it on again, you're going to cover up your client's eyes. And I'm not going to turn it on for the video, but I just want you to see what I would do. So then I would be able to go in and perform any extractions that I would need to. And then I'm going to toss the set of Q-tips and get a new one, soaked in astringent. Toss it, get a new set, soaked in astringent. And you wouldn't want to perform extractions any more than 5 to 7 minutes because it could potentially be uncomfortable for the client. So you kind of want to move through this process pretty quickly. And that's it. My client does not have a lot, thank goodness. So I would turn this off. I would move it out of the way. And then I can remove the cotton rounds, throw them away, and then you would remove your disposable gloves and throw them away. So all these single-use items would just be immediately trashed. So you did your exfoliation, your extraction, and now you're going to tone. And once you tone, the nice thing about what happens next is it's really calming and comforting for the client. You get to step into the massage portion of your facial, which is great. So the client has been through all that tough stuff, and now you're going to give them a nice massage. One thing to note is you definitely want to make sure you get enough of your massage product when you go in there so that you don't have to leave the client with your hands once you start your massage. So I'm just spreading that massage product out. Then I'll be able to start my massage, and we can just take a nice few minutes here to relax for the client, and she'll be able to get a nice little relaxation after that extraction. And then you don't have to go back and get more massage product. So now you're going to remove your massage product. Let me just fix her hairnet. Fortunately, nothing really stays on my mannequin very well. After you remove that, you are going to apply your mask. I'm going to use my brush for the mask application. Of course, you're going to follow manufacturer's directions. You're going to avoid the eyes, nose, and mouth. And once your mask is on, following manufacturer's directions, that mask is going to sit on there for 5 to 10 minutes. But we are doing a video, so we are going to assume that the 5 to 10 minutes has already elapsed, so we can go ahead and remove our mask product. And once you've toned, then you can apply skincare. And so we're going to take a little bit of eye cream. We're going to use our ring fingers to apply it because they're the most delicate. So you're going to do a nice little light tap on the zygomatic arch and the brow bone. So you're just going to apply that eye cream. And the moisturizer that I'm going to apply is full of SPF, nice and hydrating. It's got a good physical block. We talked about the importance of sunscreen. She's definitely going to be going home with some SPF today, as well as some other products. So we talked about that in our client consultation, and she said she didn't have a good one and she was really looking for a good one. So I'm just making sure here that I get it everywhere, and then also on her neck and décolleté in case those are exposed, and then we're going to finish our facial. And then you would give her that privacy that she needs to where she can get dressed. So I'm just removing her towel, and I'll say I'll meet her out in that client area where we do our consult. And what we'd want to do then is do all of the follow-up and maintenance conversation that we need to do. So like thinking about aftercare, she's going to go home with that aftercare kit, but we're also going to make sure there's a couple of things that she was really concerned about. One of them, we already know that she was going to go home with a daytime SPF moisturizer. The other thing is she was looking for a really, really good serum and lotion to make a difference at night. So we're going to talk about some of those things, and then we're going to get her booked for her next appointment. So we're going to close all of that out. Once we do that, we need to go back to our room and get ready for our next client who's coming in also for a facial. So any single-use items at this point would be discarded in the trash can. If you haven't already, any implements that you've used that are now dirty need to be put in a closed container labeled to be disinfected. You would also take any of the bedding that you've got on your facial bed, like your sheets, your towels, etc. They're going to go in a closed container until it's time for laundry. And then you're going to identify a proper cleansing agent. You're going to read and follow manufacturer's directions for mixing and usage so that you can wipe down all of your work area and remove any debris that might be there and equipment. And then you're going to identify a disinfectant that is bactericidal, virucidal, fungicidal, EPA approved for use in a salon setting, which means you're going to need to find another pair of disposable gloves because you're going to need to use disposable gloves to use this product. You're going to read and follow manufacturer's directions for mixing and or using the appropriate aerosol disinfectant. You'll disinfect electrical equipment and store it in a clean area separate from other implements, and then you can take those gloves off and throw in the trash. And then it's time for a final hand wash to finish up. So you're going to wet your hands at the sink, get that coin-sized liquid hand soap, wash your hands down to your wrist. You're going to wash the back of your hands down to your wrist. You're going to wash your fingers. You're going to wash the back of your fingers. You're going to wash those fingertips and nails. You're going to wash between your fingers and your thumbs. You're going to wash your thumbs, and you're going to wash your wrists. You're going to do all of that interlocking wash for a minimum of 20 to 30 seconds, and then you're going to give everything a thorough proper rinse underneath the water. When you feel like you've done that, grab a disposable paper towels or a clean towel, turn the faucet off with the towel, dry your hands off. If it's the paper towels, they go in the trash. If it's the clean towel, it's now dirty and it's going to go in that closed container until time for laundry. And then you're going to find that hand sanitizer, 70% ethyl alcohol, and you're going to use it to finish your hand wash. When you've done all of that, you have officially finished, and you can move forward to prepping your room and your area for your next client who is getting ready to come in for a basic facial. So that's the end of this basic facial video.